Okay, sorry, this is my third part to my interview tonight. For some reason, my phone is not working appropriately, so I apologize that there are three parts. It wouldn't normally happen. However, I was definitely deep into each section where I didn't want to disrupt the therapy session and start over. A couple of things that I wanted to touch on after the client had left was in the video demonstrating the assessment of the client's orientation, the time, place, and situation, mood, effect, and speech. I did kind of want to brush through that, and because it is kind of hard to assess that on a child in an interview. However, she did a really good job of assessing where she was, what she was doing there, the time and the date. She appeared to be a little anxious in her session. I know you couldn't see her, but at times would be a little cheerful or on the manic side. At other times would be very anxious, very fidgety, very head down. The rocking was in place a lot. General tone, she wasn't very irritable. She wasn't withdrawn. She was more just cooperative, a little shy at times, as you could hear. She would back away from the camera or back away from talking. She was definitely a little bit disoriented in that some of the questions she got off topic on very quickly, and that was very difficult for me as a therapist to stop her a few times and say, how about we just go with yes or no? How about we just stay on this topic? She really wanted to veer off into other areas, which we would do in further sessions. Her eye contact was very poor. If you had the camera on her, her head was down very often, or looking around like this, looking around like this. She had a really hard time staying focused on eye-to-eye contact. Her insight was between fair to poor. As you could see, she had very good insight on her feelings and her status. However, when she started talking, she often got off track. Her insight got very off track as well with that. She seemed to have a little bit of sleep disturbance, and that she kind of talked a little bit about it, having issues with sleeping the whole night, but nothing too bad where it struck me as a huge concern. Her appearance was pretty on track for an 8-year-old child. She had good hygiene, she was groomed, her hair was combed, she was wearing clothing that matched thought and perception. She seemed pretty guarded. She was very irrelevant at times, but very relevant when it came to her emotions and how she felt, which was really good for an 8-year-old. It was even above where I would have thought an 8-year-old would be. Let's see here. Her speech was very soft. I'm sure there's times where you had a hard time hearing her. I'm sure that's because of her age, as well as that she's being videotaped. That had a big part of it. She kept veering away from the video camera, backing up, making very big distance from this phone and herself. Her speech was, besides that, was slowed at times, but pretty appropriate for the age. There was no big concerns there. The risk of harm was low at this time. She didn't understand exactly what suicide was when we went over it. She denied any ideation. I didn't sense any plan or any harm in the past. As far as any further comments that I have would be, when making a treatment plan, I would definitely want to work on her embarrassment, the heartbrokenness, the coping skills, and then rejection and grief and loss. We talked just a tad bit in our session about the deviation from, the 3Ds, I guess, but the really big one is the functioning one. She can think of before when she moved that things were a lot different for her than after when she moved, and so that's a big, huge, significant change in her life. As far as the expectations go, she talked a little bit about how her life was prior and how her life is now, and so setting those expectations up. And then cultural, it was hard to assess on an 8-year-old any cultural things. As you could hear at the beginning of our session, I kind of went over a little bit of cultural and diversity topics. However, it's really hard to assess those with a child. I believe that is all I needed to record tonight, so I appreciate you listening to me again. I apologize that there's 3 sections to my video. I hope that it will be easy enough to just click on them and continue on. Have a good night. Thanks.